While Limpopo Healthcare workers started receiving their COVID-19 vaccines on Friday, the province has set up 2 vaccination centres in the province to date. The Phase 1 vaccination program was launched by Health MEC Phophi Ramathuba, who was the first to be vaccinated. She joins me now to speak about the progress made thus far with the vaccine rollout and also how it's been received by healthcare workers. Thank you so much, MEC, for joining us this evening. Let's start off with this question around what you're feeling after having taken the jab. Are you fine? What's your condition like? Any detected side effects?
Evening, Faith, and evening to all your viewers out there. We must indicate that the Premier of our province, Honorable Chupu Mathabata, is the one who did launch the vaccination of the healthcare workers. Yes, indeed, I was the first health worker to receive the vaccine. And I haven't, it's just like all the other vaccines that I've received in the past. Last year, received the flu vaccine, H1N1. I haven't developed any adverse effect or any side effects, whether mild. I haven't. Even the pain was very minimal because the professional nurse who was vaccinating me, she was warm and gentle. And I think she was good. I didn't even feel the pain.
Yeah.
I'm fine. I was on duty throughout, even today.
Well, that is great to hear. Let's stay with the subject of nurses, because there have been various reports around nurses being a little bit apprehensive, or some nurses being a little bit apprehensive about even taking the vaccine, that they were comfortable given the dissemination of information around the AstraZeneca vaccine, but when it comes to the Johnson & Johnson, there was simply a little bit not enough given to capacitate and to inform the nurses. Also, nurses have also complained about the utilization and the user-friendliness of this EVDS system, and saying that indeed technology has become a weak point in the ability to register timelessly online. How are you mitigating against that? And also with the nurses, some of them fearing of taking this vaccine?
Yeah. Starting with the nurses who were fearing to take the vaccine, I think that's one of the reasons why I had to take the vaccine. Because my wish was to make sure that all those who are on the bedside of the patients be the first one to receive the vaccine before I could get the vaccine. But to reassure them and also to emphasize the fact that our president took this vaccine, our Minister of Health, I had to also take the vaccine. I think that has really assisted a lot, because after I took the vaccine, that's when everybody else felt that there is nothing wrong with the vaccine. The MEC has taken it. She waited for 15 minutes and nothing happened to her. She continued to be with us, to work with us even today. So many of them started to coming on board to do to be vaccinated. And then, of course, we've had a lot of bad publicity on the social media about people. Some of them knows nothing about a vaccine or medicine. They are just very good at criticizing. We expect them. There are people who their role is just to sit down and wait for any innovation that comes from government and criticize. So it is our responsibility as public representative to assist and support and give our healthcare workers information. Don't judge them. You must appreciate the fact that the other voice was more louder than yours. So it's time for us to be more louder than the negative voice out there, which we are doing that. And we have seen that that has assisted in mitigating that most of our healthcare professionals are taking the vaccine.
Yeah.
And what we also did in the province was to make sure that even our heads of clinical department, for instance, the head of neurosurgery, he himself, Dr. Nkuna, came on board and get vaccinated and went out to say, I'm a brain surgeon. And this thing of saying your brain or whatever it is, I'm taking the very same vaccine. Our head of surgery have done that, and all other clinicians, our head of forensic pathology. So when you've got those leaders in the industry itself, the Dr. Mangena, for instance, was the first doctor to be vaccinated.
Yeah.
This is our head of internal medicine, who has been busy dealing with COVID-19 patients since the 16th of March.
Dr. Ramathuba, just for the sake of time, if I may just interject there, are nurses or healthcare workers struggling when it comes to the registration process because of the usability or the user-friendliness of the system?
I think it's not necessarily the issue of the user-friendly. I must first admit that indeed we have been having challenges. That's what was delaying actually the smooth sailing of the whole registration process. It's the issue of people not used to be utilizing technology. What I have picked up, like for instance, today when I was in Petersburg Hospital, we ended up giving them our own gadgets, because you need an Android gadget. Most of them, they're our nurses, and we appreciate that we're in rural areas. They're using all those cell phones which can't even share a WhatsApp. So you should appreciate that phone will not be able to allow you to access to register. So what we have done is today we put up our team of from the IT, from corporate services, to say we had to recall them to come on board. And even our staff in my office, we had to come on board and start assisting all of them to register. And we even went on social media to teach them, to say, those who are still at home, talk to your child. Your child has got a better phone. Let your child help you to register. And that's why after lunch, you saw that numbers started to move. So we are appealing to them to say, go to our social media, Facebook. You will see Dr. Murifi is there. She will be showing you exactly how to register. And we're saying to children, you have got a mother who's working in the hospital, either as a cleaner or any other profession within the hospital. Show her how to register. She'll get those SMSs, help her to follow it up. She will quickly register. She'll get a voucher. When she comes to the hospital, it won't even take 2 minutes.
We have to leave it there, Dr. Phophi, but thanks a lot for giving us the insight in terms of that rollout plan. Limpopo's Health MEC, Dr. Phophi Ramathuba, they're giving us the latest.